A very warm welcome to all the parents listening to this Medical Facts with KIMS Cuddles. I am Dr. Parag Dekate. I am Clinical Director of Pediatrics at KIMS Cuddles, Kondapur. Today we are going to talk about a few common questions and myths related to the fever. Fever is one of the commonest symptoms we see in all the kids, and on our social handle we see a lot of questions related to the fever. So today we'll go through these important questions related to fever. So as to let you all people know, there is a diurnal variation in the body temperature. The morning temperature is a little bit lower and the evening temperature is higher. But any temperature which is crossing more than 38 degrees Celsius or more than 100 Fahrenheit is called as a fever. So you should not be worried if your temperature is less than 38 degrees Celsius or it is less than 100 Fahrenheit. So there is a standardized places where we should check the temperature. Those are mouth, armpit and in a rectal area, which is usually utilized in the hospital scenario. But with the development of infrared thermometers, the temperature can be checked over the forehead with the infrared thermometer. But the standardized ones are armpit and mouth. So the research says that the internal temperature, which is basically a mouth temperature and a rectal temperature, is approximately 0.4 degrees Celsius higher than the armpit temperature. But for generalization purpose, it is not recommended to add any degree Celsius or Fahrenheit while checking a temperature in the armpit. That means the temperature what you see in the armpit is the exact temperature of the body. So remember, the all fever doesn't make you go to the doctor immediately. There are certain things you need to see when the baby is having fever. So what are those things? If the temperature is more than 100.4 Fahrenheit for more than 2 days, or you have an associated symptoms related to fever, what we call it as a danger signs. What are those? One is child is not accepting orally, child had a seizure, child is not looking well, child is having a loose motion, child is looking dehydrated, child is not accepting feed, there is a rash all over the body, breathing difficulty, or anything parents concerned about, you should visit the doctor immediately. Otherwise, if the child is doing fine, hydrating herself or himself, and activity is good, you can wait for 2 days for visiting the doctor. Lot of parents ask, if the temperature goes to 101, 102, shall we give a rapid sponging? So as there is no research suggests that the rapid sponging is helpful for lowering the temperature of the body, because rapid sponging lowers the outside temperature, still the inside temperature can be higher. At the same point of time, utilizing the same water repeatedly for rapid sponging increases the chances of infection. So sometimes it is recommended to give a baby lukewarm water bath instead of giving a rapid sponging. So because there are a lot of devices available in the market, parents usually get confused which thermometer is the best. To clear this myth, the mercury thermometer is the gold standard, which has to be kept in the mouth or armpit for at least 3 minutes, and then you check the temperature accordingly. But there are digital thermometers available which can be utilized in the mouth as well as in the armpit. The new addition to this is infrared thermometer, which gives you a reading in the 5 seconds. It is advisable to check the temperature 3 to 4 times with infrared thermometer before finalizing the exact temperature of the baby. So a lot of kids get a shivering with the fever. Remember, shivering is a protective mechanism. When the body temperature goes from lower temperature to higher temperature in a short span of time, then you start getting shivering. Shivering is a mechanism by which body tries to lose the heat. So shivering is not always bad. But having said that, remember about the danger sign. So if you have a fever with shivering and danger sign, then visit the doctor immediately. Answer to this question is no, but you should be careful in those kids where there is a history of febrile seizures in the family. That means having fever and then seizures, or any children who are having a neurological symptoms in the form of encephalopathy, child is not waking up, child is not moving hand and leg, and child is not interacting with the parents, the chances of having fits increases in those kids. So a lot of parents ask that when the child get a fever, what we should do. So remember, there are few things which are very important. One is kindly make it sure that they are hydrated well, because during the fever the requirement of water increases exponentially. So make them very well hydrated. You can utilize milk, buttermilk, ORS, juices, so that they are hydrated well. Don't skip the meal. The chances of infections are very high when you have a fever. So give them a healthy and nutritious food. You can reasonably use a doses of paracetamol at least 4 to 5 times a day, a minimum gap of 4 hours between the two doses to reduce the temperature. Don't utilize the crocin or Calpol if the temperature is less than 100 Fahrenheit, and keep looking for the danger signs, so that if any of those danger signs comes, you can visit your nearby pediatrician. As we discussed, the most important thing during the fever is continue giving a good hydration and a good food. Simultaneously, you can utilize few medications. One of them is paracetamol. The dose for paracetamol is 15 milligrams per kilo. Make it sure that you are not giving more than 5 times a day and maintaining a distance of approximately 4 hours between the two doses. And remember, utilization of ibuprofen and Meftal is not safe in the kids. So kindly contact your pediatrician before utilizing Meftal and ibuprofen. So when the body temperature goes more than 106 Fahrenheit or more than 41 degrees Celsius, we call it a hyperpyrexia. There are some genetic conditions related to hyperpyrexia. So whenever you see the temperature going more than 105 Fahrenheit or going more than 40 degrees Celsius, it is prudent to meet your pediatrician immediately and take a medical advice immediately. Thank you.